gave me the comfort and the confidence to proceed with applying. And so, literally, within, I'd probably say about 6 weeks, I applied to Ross University. I interviewed with them. They offered me an acceptance. I quit my job. I packed my bags and I moved to Dominica all within like 6 weeks, and I started my medical school journey. And I think the reason is because for me, I didn't want to retake the MCATs. I was obviously a terrible test taker, which I can tell you from the SATs and every other exam that I've taken. I just knew that waiting around to try and improve my MCAT scores, it was just going to be a disaster, and just continuous waiting to reapply to US medical school. So for me, getting that confidence and that answer from him, it just reassured me that I was making a good move.
Yeah. The IMG Roadmap is the only podcast dedicated to coaching international medical graduates in success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams. Hey everyone, welcome to another episode of the IMG Roadmap podcast. Today's guest is Dr. Pooja Sharma. She's board certified in non-operative sports medicine. She completed medical school at Ross University in Dominica, and she completed a family medicine residency at Emory in Atlanta and proceeded on into sports medicine fellowship in the Atlanta, Georgia area. Welcome to the podcast, Dr. Sharma. We're so happy to have you. How are you doing?
Thank you. Thank you so much for having me. I'm doing great and excited to be here.
Awesome. So where are you calling from today? What part of the country are you in?
Yeah, so I'm in Miami, Florida.
Nice and warm. Oof. Most people are going to be listening to this in the winter time, but whenever you're listening to it, just know Miami is like the place to be. I love Florida. I have this like fascination of living in Florida, but I don't know if it would ever happen because, life happens. But we're so happy to have you. So happy to have you. So can you share with us a little bit about yourself? I know I kind of gave a brief intro, and that's something that I just got from Mount Sinai Medical Center website, but can you share us, tell us about who you are?
Sure. Thank you again for having me. So my name is Pooja Sharma. I'm originally from New Jersey. I did my undergrad studies at Rutgers University. I then went on to Ross University in the Caribbean to do my medical school training, and hence why I'm an IMG, or considered an IMG. I completed my family medicine residency at Emory University in Atlanta, and then went on to do my primary care sports medicine fellowship at Northside Hospital, also in Atlanta. And I just started my first big person job as an attending physician doing non-op sports medicine at Mount Sinai Medical Center in Miami Beach, Florida.
Awesome. I think that is so cool. But I feel like our audience, maybe they didn't get an opportunity to rotate in sports. I feel like people who go into sports probably had knowledge about sports beforehand. But a lot of physicians, especially when they go into family medicine at first, they don't even realize like what opportunities are available for them in the sports world. We always think it's only ortho. But can you share with us, like, what is a day in the life of a sports medicine physician? What was your fellowship like? And then obviously we'll come back to the juicy details of your medical journey.
Yeah, absolutely. So first of all, sports medicine can be done through different avenues. So sure, you can go through it through orthopedic surgery and that route. You can also go through it through family medicine, pediatrics, internal medicine, emergency medicine, or PM&R. So those are some of the avenues that you can go into sports medicine that way. In terms of a day in the life, so during fellowship, we'd start, seeing patients at about 8 a.m. and see patients, throughout the day until 3, 4 p.m. Usually on our days, especially in the fall when football season is in full swing, or basketball seasons in full swing during the winter, we'd have our training room. So we'd leave clinic, go to the training room, see our athletes probably for like an hour or so, and then typically have a game, that evening where, we'd kind of be on the sidelines or, in the arena, kind of making sure our athletes were safe and sound, while they were playing their game, and evaluating them as needed. And so that's typically how a day in the life is in a non-op sports medicine world.
Okay, awesome. And can you share with us like the procedural side of non-op sports? Because I think some of us in family medicine, like we love to do stuff with our hands, but we don't realize that there's opportunity for like ultrasound training, like musculoskeletal procedures, even as a family physician, especially if you have that additional sports training. So tickle our brains a little bit, because for those of us who are feeling like, yeah, I went into family medicine as a backup, some people do. And now they're thinking, because I didn't get into ortho or it was difficult as an IMG, what can I do in sports? So give us some insight.
Yeah, so definitely palpation guided injections. You learn about ultrasound guided injections. You can do like 10 jet procedures. You can do PRP injections. So there's a lot of different kind of procedural opportunities that are available with doing a sports medicine fellowship. You kind of get that enhanced training on how to evaluate tendon pathology, how to do intra-articular injections. And, again, they can be done all in the office, so which is nice. Not only that, but then you're also just scanning and ultrasounding patients, so if they come in with a calf strain or concern for a hematoma, you're evaluating that under ultrasound. And it's nice because you kind of have that as a tool to be able to diagnose and treat your patients accordingly. And you don't need to necessarily wait for additional imaging like MRI or CTs or whatever. You kind of have the ultrasound to be able to kind of guide you in terms of your treatment plan and different options.
Yeah, that's so awesome. Thanks for sharing that. So let's segue into most of our audience tends to be trying to get into residency. We have a small fraction that are already in residency, and I feel like that what you just shared would be very helpful for that person. But even for the person who is like a future planner, they may be thinking, what was your journey like into family medicine, especially because you are a US IMG, so you're a US person who went to Korean medical school. Talk to us about that. What was that process like for you? And why did you go to the Caribbean even?
Yeah, so full transparency, and I like to be honest with anybody that I talk to. So in college, my grades were pretty decent. I was told by my pre-med advisor that I wasn't going to get into medical school and got the rejection. But after I finished college, I retook my MCATs, did terribly on them, like really, really, really bad. I don't even think that score exists. And so I kind of was just trying to figure out my life, probably like everybody else, figuring out like, is medicine for me? Am I doing this? What are some of the other options? And during that time, I was also doing research. So I did kind of have like a little bit of a job, but it was part time, but still trying to figure out what my life was going to be. So I reached out to a family friend of mine who had gone to Ross University in the Caribbean. And I straight up was just like, how was your experience? What was it like? Got kind of the inside scoop on what medical school in the Caribbean was like, because we hear so many different things, good and bad, from that experience. And I think the one question that I asked him that really stood out to me was, if your daughter was applying to a Caribbean medical school, would you as a father feel comfortable sending her? Obviously from a safety issue, but also from the educational side of things. And he said, yes, absolutely. And really, that gave me the comfort and the confidence to proceed with applying. And so, literally, within, I'd probably say about 6 weeks, I applied to Ross University. I interviewed with them. They offered me an acceptance. I quit my job. I packed my bags and I moved to Dominica all within like 6 weeks, and I started my medical school journey. And I think the reason is because for me, I didn't want to retake the MCATs. I was obviously a terrible test taker, which I can tell you from the SATs and every other exam that I've taken. I just knew that waiting around to try and improve my MCAT scores, it was just going to be a disaster, and just continuous waiting to reapply to US medical school. So for me, getting that confidence and that answer from him, it just reassured me that I was making a good move.
Yeah. So let's talk a little bit about that, because, there's several of us that went to Caribbean medical school who either had lower MCAT scores or, maybe financially couldn't afford to pay from pocket, or didn't have the financial backup for maybe a good hefty loan, and different reasons. There are multiple reasons why, some choose, and some choose to go in just right off the bat without any kind of secondary reason. But I've noticed that whole, from the camp that I've heard of who struggled with MCAT, they usually always feel like there is a part of their education now that is subpar. And it's such like a false narrative, because here you are, board certified in family medicine, doing sports medicine. Is there ever a day in your life where someone asks you, where'd you go to medical school, or how does that affect the quality of care that you provide? Does it even?
No, to be honest, I think when I came back stateside and did my rotations and we were just in line with the US medical students. We were working just as hard, if not harder, to be honest, because that's just how we're trained as IMGs, to kind of work harder than everybody else in the room. So I don't think that my like MCAT scores, nobody's ever asked me what my MCAT scores were, or, how my step scores affected kind of my trajectory or anything like that. So, I think that in that moment, yes, it's kind of a hard realization to face, but a couple years beyond, no, nobody asks for it. Nobody really cares.
Yeah. Yeah, and I think that's so important for our audience to hear because I've just talked to so many IMGs and I understand the failures of the past and how they can haunt us. But one of the reasons in this episode that we want you to take from this conversation is no matter what has happened in the past, you still have a chance at correcting the future and you could still be the things that you want to be in medicine, whether that's family medicine, sports medicine, or another specialty, irrespective of how bad you've performed before. Because there's so many people who come into med school and they're still dealing with the MCAT failure or the fact that they didn't get into a US medical school, and it's holding them back from just fully experiencing medical education and fully being present in their medical education and enjoying the ride. I know it's a difficult journey, but my hope is, what if we could make it more enjoyable? What if we had more direction and coaching and education that helps make the journey easier, which is why we're doing what we're doing today in this interview. So
Absolutely.
yeah. So tell us about your journey through step one, step two, step three. What was that like for you?
Yeah. So again, full transparency, I really struggled, and I will be honest with you. So at Ross, we're required to take an exam called the comp exam, which is kind of an exam that you have to take and pass before you take step one. I could not pass that exam for the life of me. I had to take it like 3 or 4 times before I passed, and I really struggled with that. And it gave me the imposter syndrome. It gave me the, oh my God, what if medicine isn't right for me? What if I can't do this? What if this is like a sign that I'm not supposed to be doing medicine? And it really pushed me back in terms of my education. Like it, about at least 8 months or so, it pushed me back from taking step one and starting my medical school rotations. And so that was a real struggle for me. So I faced that. Finally, when I finished taking comp, I took step one and I didn't do well. I mean, I passed. I took it in, I think, want to say 2016. And at the time, I think the cutoff score, like the passing score, was a 192. I passed with like a 198. So just skimmed by. But I think the one thing that it taught me was learning how to study and what was most suitable for the way that I need to study, not only for step one, but for step two, step three, board exams, whatnot. I've been able to pass all of my exams on the first try, which is great. And I think the one thing that I learned, especially from step one and having such a low score to step two, was that, again, I learned how to study. I think I jumped up like 20 or 30 points from a step one to a step two. And I think, again, programs do care about your scores to a degree. However, they want to see the improvements that you've made. So if you have a low step one score, it is not the end all be all, right? Because if you improve on a step two, that is your way of telling them that I've grown, I've improved, I've learned from my mistakes. And this is all that I've shared in my residency application process and during my interviews, is I've shared kind of the growth that I've had. And I think that they can appreciate that.
Yeah, absolutely. Growth experiences are huge, but sometimes I feel like we're just so stuck in what has already happened that it's so hard to see beyond that, right? It's so hard to see beyond, oh, I struggle with my comp. So every time you're taking another exam, you're thinking, am I going to struggle again because I struggled with one thing before? But just like you said, there's so much to be gained from asking yourself this question. What can I learn from this experience? What can I take from this experience? As opposed to what has this experience left me with, right? There's a difference. You're either in that mindset of being a victim or you're in the mindset of taking charge of your life where you're like, okay, well, I've struggled with comps. I know that's an issue. However, what can I take from this experience? I can learn how to learn. I can learn how to prepare for these exams so that the next time I'm faced with that exam, I have a different approach, right? So many of us
Absolutely.
don't do well in these tests, not because we're not smart, but there's multiple reasons. There's ADHD, there's some learning differences. And then there's just the pure anxiety of this test means everything. And so we're not reading through those terms really well. We're not reading through every question in the way that we're supposed to, right? Because those questions are tricky. They give you like 5, 10 sentences, but really the question is in that last sentence, or it's embedded between two other sentences. But a lot of times it's just because of the mindset that we're in that season. I mean, would you agree?
Absolutely. Yeah. No, and totally. I think that you harp on the bad of, right, I didn't pass my comp exam and like, oh my gosh, this is going to happen again for step one and I'm going to be delayed. And I see everybody else moving, right? I see all of my friends and my colleagues going through their rotations and applying for residency and I'm stuck. And that was a real struggle that I faced. I was like isolating myself from everybody else because I was like almost embarrassed. But I think, again, hindsight is 2020. I think what it taught me is like, again, how to study, the importance of doing questions. I think, I know for me is I was always like, man, I don't feel like I know this well enough. I don't have it memorized. I don't know this with my eyes closed. And yet I would leave questions all the way till the end when my exam was near. And that's not the way to do it, right? Like the one thing that I've learned from taking so many tests now is start doing questions early because the questions actually help you learn. They teach you how to approach a question. They
Yeah.
teach you what's important and what's not. And so taking all of that in to be able to be successful for these exams is really important.
Absolutely, 100%. The most effective way to learn is to position yourself in the environment in the way that you will be tested. And so, if the test is this tricky multiple choice exam, then the more you participate in those kind of multiple choice questions while you're learning those concepts, so like during your rotations or even in school, and you're using questions to direct your studying, the more likely you get familiar with the environment that your real exam would be in. And I've always said this: active learning beats passive learning.
Yeah.
Passive learning is reading a book, looking at pictures, looking at diagrams. Active learning is deciding you're going to dissect it out and draw it on your own. Active
Yeah.
learning is you're going to write it out on your own. You're going to read through the question, answer the question, get it wrong, but then you're going to go through every single answer and why was A wrong and why was B wrong? Well, was A really wrong or was it just a misrepresentation? Is it the right answer for something else? And I've noticed that when you ask those questions and you start to realize medicine is really sweet. Like I always notice this when I'm studying something that I don't understand and I take my time to really go through an active learning process. Medicine is so fascinating.
It
It is
is.
so like interesting. Like I like when I'm studying and I go into like flow area, like full flow zone. But it only happens when you've really sat on an item for a while and you've really digested it and you're really thinking through it. And you're just not like, oh, I just want to get the answer right to pass the test, right? Which is
Mhm.
what a lot of us end up doing in the last minute.
Mhm. And the
But
best part is like when it finally clicks,
yeah,
right? Like when you have that like aha moment of like, okay, like that makes sense and that puts all of the pieces together. Like
yeah,
that's like the best feeling.
it is, absolutely is. Let's talk about the comp a little bit more because I mean, it's something I hear a lot from Caribbean students. They're always like, I'm still working on my comp, or my school won't let me apply like in September because I haven't passed my comp and I still need to do that before I can take step two. So, in your hindsight is always 2020, right? So now you can look back and especially after dealing with multiple comps and not passing them. Did not passing your comps ever come in the way of your final residency application or residency, or you obtaining residency?
No. And I think the reason is because I, again, was fully transparent with them on my application. So when you apply, right, you obviously I had this big gap year smack in the middle of medical school, and they were just like, what happened here? Right. And I explained to them, I was like, listen, I didn't do well on comp, and I almost like beat them to the punch, right? I said it before they could kind of almost ask me. And I said, listen, I had this gap time where I was trying to study for comp. I really wasn't, couldn't pass it. And I think it really taught me how to study. And again, you got to spin the negative into a positive. And so, really explaining that, like, hey, listen, this taught me how to study. It really taught me how to take an exam, really break down the material and kind of in a way that I could understand it, and really got me, to pass step one on the first try, step two on the first try, whatever. So I think, again, if you can spin the negative into a positive, I think that that really is a highlight for you. But
Yeah.
otherwise, no, they don't care in terms of like, I was only really asked the question, but it was never like a red flag for anybody.
Yeah, and I agree. I don't think your comp becomes a red flag for you down the road. Usually, I've noticed that the question comes in maybe the duration of time that it took you to complete medical school. So for those who get the comp or they don't pass the comp and then they have to extend their education, I think that's the question that I've noticed programs may ask. And they don't always ask. They usually ask if it's like over like a 4 or 5. Well, if it's 4.5 years, I don't think it's much of a deal. Like it's when it's 5, 6 years, then it's like, okay, what happened with you that it required 6 years to complete a 4-year program?
Right.
And that's usually the way that it's asked. And I've also noticed it's not being asked in a way to like single you out. It's been asked to gain an understanding of
Right.
what happened. So it's asked as a clarifying question. So instead of us kind of caving under the pressure of that question and thinking, oh, this is going to be the reason they don't give me an interview, or this is the reason they're not going to rank me. No, they want to know a little bit more. It's imperative upon you to explain why a 4-year program took 6 years and so on
Mhm.
and so forth, if it did. But your comp, I almost want our listeners to look at it like it's actually a guiding light, because the last thing you want is to go take the exam and fail it. So
Yeah.
you're better off being held back temporarily just so that you can gain the time to apply a new strategy and then move forward with your step and pass it on first attempt. Low, high score, that's up to you, but passing it on first attempt, we know is critical, right?
Mhm.
So I really like that you brought that up to share with the audience, because that's usually a stronghold that a lot of people don't talk about, especially on the podcast. We just want to focus on step one and pass step one, pass step two, but it takes a lot sometimes. Like there's a process as to how we get to passing those exams. So let's segue into applications. And what was your process for family medicine applications? How many did you go for? What was your strategy?
Yeah, so I had the mindset, as I think everybody kind of should, is that get in on the first try, right? Like the worst things is trying to like reapply. Obviously, there's times and scenarios where that needs to happen, but your whole goal is to try and get into residency on the first try. So I applied to a lot of programs. I want to say probably to like, I want to say around 200 programs. I was specifically focusing on the East Coast because that's where my family is. And so I kind of tailored it to the East Coast. But otherwise, I didn't have many stipulations. I applied very broadly, very metropolitan cities, rural, suburban, community programs, academic programs, what have you. I applied kind of any which way. So again, I finished off cycle during I think like a match cycle. So I had to wait until the next match.
Mm-hmm.
And when I applied, so obviously, again, I had some time off. So I had found a research job. I moved back home to save some money. And I, was doing my research and my homework on different programs, family medicine programs. And so again, I applied to almost about 200 programs. I probably want to say I got like 15 to 20 interviews of the programs that I applied to. But I think the one big thing for me that really worked in my favor was going to the AAFP National Conference and being able to like network with programs and program directors and faculty and the residents, because I think that helped propel me to get a few more interviews that maybe I otherwise wouldn't have. And so I applied to about 200, got about 15 to 20 interviews, interviewed with all of them, and then definitely went back for like a second look on a few programs that I was interested in. And that's kind of my journey of my application process.
Wow, yeah. So I've always recommended for med students, I know AFB also has its regulations as to who can attend that conference. The moment you know you want to do family medicine as a specialty, please register for the AFP Residents and Medical Students Conference. Usually happens once a year, guys, and it's usually in Kansas City, and it's about July, I believe, every year. So if you are not sure what we're talking about, first thing you want to do, go on your internet browser and just type in AFP Medical Student and Resident Conference Kansas City. It will come up. They have like a cutoff from a year of graduation, I think. Every year that number seems to change. I've seen 3, I've seen 5, because they're trying to keep it to recent grads or active medical students and current residents. But the advantage of that conference is there's so many family medicine programs that would be present there in their exhibition hall. It's sort of like a recruitment fair. That's how I look at it. Obviously, there you can learn there, but people go there for recruiting, and that's programs are recruiting there, and interested applicants are also seeking programs that they would like or want to talk to. And it's like an informal place to meet program directors, residents, and really just chat with people. I cannot count a number of my mentees who had really maybe not so impressive portfolios, were it super competitive, who I recommended to go to conference and came out with 2 or 3 interviews. So many of them, even in the cycle. Old IMGs, even, or people that feel like they're elderly or whatever the case may be, who get a chance to go, maybe because their year of graduation, they're able to get some kind of loophole that way. Everybody always comes out with at least one or two interviews more than they would have had. So definitely a worthwhile investment. And bonus points if you can even present a poster or presentation, guys. I think that would even take it up another notch. So let's talk about fellowship applications. How was that process for you? At what point in your training in family medicine did you know you were interested in sports?
So I kind of always knew I wanted to do sports medicine. And when I was in medical school, I kind of started eliminating everything, all of like the six major kind of psychiatry, internal med. And so I landed on family med was for me. But I always knew I wanted to do sports med. And so when I realized that I could do it through family medicine, that was like a bonus. When the application process for fellowship is it's similar, but also a little bit different. So you apply between the second and third year of the summer between the second and third year of residency. And their match process is you find out the results in December. Mm-hmm. So you kind of interview between like September, October, November-ish, and then you find out in December or January. The process was still very similar to the residency application. So you go through the ERAS application process, you got to get a token, you look up programs, you apply, you interview. But it was very similar in that sense, just the timing was a little bit different.
Mm-hmm. Yeah, and when you have to go through a fellowship application, do you feel more experienced because you've gone through the residency process to where it's like you would say it's much easier applying to fellowship?
Yes, it was much easier. And actually, what I noticed was that some of the information from residency already auto-populated. So a lot of the information that was on my residency application already had auto-populated into my fellowship application. So the information that I really needed to update was my letters of recommendation, any of the sports kind of activities that I was involved in, any of the new research that I did in residency, really any of the residency stuff that wasn't already in the application. I just needed to update. But it was nice because a lot of the other stuff auto-populated. So that made the application a lot more easier. And again, yes, it was definitely like I felt more experienced having gone through it already for the residency, that I felt a little bit more confident in my application and just going through the interview experience.
Yeah, I agree. Like once you've gone through this process once, it's like you're forever a pro at it.
Yeah.
So a fellowship is not as daunting or as scary as it may seem. I think with fellowship, it's just for those who are thinking ahead. It's really just about maybe knowing what you want. I think is the most difficult part, like identifying what you want with your family medicine career, and then finding mentors that can guide you along the way, maybe other attendings in your program who've done that particular fellowship, or other residents even like that have done that fellowship. Or now Dr. Pooja Sharma, who's on the podcast, and hopefully next year we'll get her contact information so you know how to reach out to her if you have similar questions about, hey, what are your recommendations for doing this sort of fellowship myself and things like that. So Dr. Sharma, as we begin to round up, I know that your story, it took years to develop, and you shared with us so much insight from failures even before med school and navigating med school in spite of those, and working hard on every step even though there were challenges with comp, and how you proceeded onto the application cycle. And I think what's important for people to realize is regardless of all those hurdles, you still were able to get upwards of 10, 15 interview invitations. And that just tells you that you had something. You were still an appealing candidate for the dream that you had. However, those challenges were there for a reason. And some of those reasons, some of us will find out later in life. Sometimes we find them as we go through the process. But I believe that there are always challenges and trials to build us up. And one of the things I was reading this morning, and when I was doing my morning devotion, was a scripture that talked about, I think it was the first letter of Peter to the early Christian church. And he talked about how challenges are supposed to be a method to develop us as people. And a lot of times there's a lot of character development, there's a lot of faith development, there's a lot of personal growth that comes with challenges. And I love that your story sort of really imbibes that, like it paints that picture for us. Before we leave you though, what are your final words of advice based on all these things, these years? So much easier to learn from the wisdom of someone who's been through something in hindsight. So now it's easy for you to tell us like, okay, here's what I would do differently. So can you identify for us some things that any Caribbean medical student that is going through that education right now is listening, what can they do differently right now to literally change the trajectory of their life?
Yeah. So a couple of things. I think, as IMGs, we obviously work harder than anybody else in the room, whether you're a Caribbean IMG or from another country, whatever. We definitely work harder than anybody else in the room. I think knowing kind of what you want, knowing what to apply for, right? Doing your homework in essence, not only for, whether you're applying to family medicine or internal medicine or something else, but also opening your mind to applying broadly. And what I mean by that is, everybody wants to be in the big cities, right? The metropolitan cities, the New Yorks and the LAs and things like that. But realizing that we do face a little bit more of a hardship than maybe other people. And so keeping your mind open to applying to rural areas and suburban areas and community programs and things like that. And lastly, I think one of the biggest things, because I've worked with IMGs in terms of interviewing and things like that with them and helping them on their residency application, I think one of the other things is being genuine, right? When you go to these conferences, the program directors, the faculty, the residents just want to see you being you. They know your professional accomplishments, they know and understand that, but they want to see the personable side of you. They want to see, like, hey, this person likes to go out to a basketball game or likes to go out and eat at restaurants or whatever. Like, just be genuine, just be yourself. Don't try to force anything or look desperate to try and get a placement or something like that. You want to be yourself and be authentic to who you are at the same time. And I think that will inevitably pull through to the program, and the right program and you will match, and hence it's called the match. So I think that's my word of advice. And the other thing is, keep in mind that everything is going to be okay.
Mm,
Everything is going to be okay. Like, medicine is not linear. It's clearly what I've learned, right? You will face hardships, you will face trouble, you will face failed exams, what have you. But just remember that everything is going to be okay. You're on the path that you're supposed to be on, and you will realize what that struggle is there to teach you.
absolutely. Absolutely. I feel like being authentic is so important to your journey, especially when it comes to the networking portion of your journey. Because if you try to, first of all, people can see through the BS, like they can see through it all. Anyone who's been in residency admissions has been through several different characters. And by characters, I mean individuals, personalities. When you have, even just as someone that coaches IMGs, I see it every day. Like, I know I can read through a lot of stuff before people even start talking to me. And that's not because I have any special traits, just because I've seen so many different IMGs going through this process that I can tell when someone's being dishonest, fake, or untrue to themselves.
Mm-hmm.
And I can tell when they're overreaching, when it's just not genuine, especially for those who use family medicine as a backup. You need to figure out some good reasons to convince at a conference why it is your primary choice. And if you're not honest with yourself, people can tell. Like, they're not gonna vibe with you. Like, that's just what it is. So I think being genuine, being authentic, being real is so highly appreciated, especially in the field of family medicine, because they're looking for physicians who actually love the specialty, not just people who want to match. They're looking for people who want to make a difference in the specialty in the ways that the specialty was created for.
Absolutely.
And
Yeah.
yeah, and being authentic to it is so super important. Before we leave you, can you tell us how we can find you on these Beyonce's internet?
So I'm primarily on Instagram. You can find me at family, the number two, sports medicine. Happy to answer any questions, share with you any of my thoughts. I love mentoring and love teaching kind of what I've learned, good, bad, ugly, whatever, and kind of sharing my thoughts with you all. So I'm happy to help in any way I can.
Awesome. We'll have Dr. Sharma's Instagram handle in the show notes. It'll be directly linked to her profile. So if you go to the show notes, you'll be able to click and connect with her and slide in her DMs and keep up with the follow-up questions that you may have. So happy to have you here. It's been my
Thank you.
pleasure to speak with you and interview you today. And we wish you nothing but the best as you start off in your new, as you called it, big attending job or big girl job. I don't
That's
remember what
right.
you said.
That's right.
Yeah.
Thank you so much.
We wish you everything that you wish for yourself.
Thank you.